Sorry, Amanda. I did not mean to cut you off with that.
Okay. I was just saying it's our different time today is to accommodate everyone from wherever they are in the world. I do see some international families here today, which is great to see.
Amanda, I'm excited to hear how folks are celebrating all over the world as we get to SCN2A Awareness Day. So I really hope folks will chime in and share during all of our presentations.
No, I love that. I love that. I see Angie Aldridge is on the call. I think she's going to have a
Angie.
cameo in this presentation today. But yeah, I think we can get started. What do you think, Melody?
I think let's go for it. All right.
So welcome everyone. I am Amanda Gale. I am Director of Programs and Operations here at FamilieSCN2A. I always tell everyone that this is, aside from being a mom to my warrior son, Henry, this is the best job I could possibly have in the world, to be able to advocate for families just like mine. It's lovely to be able to be in a position where um, I get it and I get you all. So I'm very, very honored to be in this position. And alongside me today is Melody, Director of Advocacy. Melody, would you like to introduce yourself real quick? I know you're going to be speaking a little bit later, but okay.
Sure, yes. Hi. I'll do a more formal introduction when I get to my slides, but it's so nice to meet everybody. My name is Melody Kaiser. I'm Director of Advocacy and longtime friend of the foundation. I'm also a mom of two neurosparkly kids and a rare disease advocate for many years. So and a rare sister. So looking forward to talking with you a little bit more. And please do, I would love for this to have strong audience participation. So please chime in and ask questions or share, volunteer anything you have.
And we're also lucky to have a couple staff on the call today. Leah Myers, our executive director, and who I'm sure will say a few words a little later, and our CSO Jeff Cottrell. I'm trying to see if we've got anyone else on the call. There's a bunch of you.
We've got some Tasca. We've got Jenny
That's
from the
great.
board.
Thanks for joining us today. So SCN2A Awareness Day is coming up. It is February 24th. That is Tuesday. I know that you know this is coming up because we have been blasting it. Um, but this year's campaign for us really stemmed from the fact that science is complex. It really is, but awareness doesn't have to be. And next slide, Melody, please. And so we are feel so grateful and lucky that we have been able to partner with all of our other global leaders in this campaign. And a huge shout out to SCN2A Germany for um, collaborating and building some beautiful reels and videos and graphics and some social media clickables to be able to get this awareness campaign out because, as it says here, awareness isn't a one-day event or even 1 month. It really does start with a community, and that is our global community, and it also is starting with you guys at home.
Right. And if I could piggyback onto that, I also want to thank these collaborators for helping with the SCN2A International Awareness Day Wikipedia page that we launched several months ago. It was a collaborative effort from lots of different partners, and as we're updating additional Wikipedia pages, we're collaborating with these friends as well. So, so glad.
So it's all about you. You all carried it across timelines and countries and communities. And I absolutely love these graphics that Germany helped create. So our logo that you've seen the last couple of years with the little people around the globe, Germany really, yep, right there. Germany took them and made them really interactive. And so from a marketing perspective and social media, the fact that they were moving and talking, and it was super creative, and a big shout out to Sarah and her team. And so some of our graphics have just been shared beautifully. They're simple, and it really does get the message across. This one here, I want to point out, this QR code leads to our programs page on our website. Leah, maybe I could get you to put that in the chat too. On Tuesday, our grants open up. So here at the FamilieSCN2A Foundation, we offer a lot of patient assistance grants to help offset costs that insurance might not otherwise be able to cover. We also have family meetup grants, which are huge. Last year, quite a few of our families took us up on those, and to be able to see families meet each other interstate and get their kiddos together, it's a real pleasure to see. I love these photos.
This one's so powerful.
Yeah.
I know them.
Yeah, they're on the call. And so this is huge because from our community to over 100,000 screens, this really is awareness in motion. It's not just engagement. It's what awareness is about. It's why we're all here. And without everyone putting in a like or a share or sending an email, we don't get visibility. Mhm. And we really did see that. Everyone did do their effort sharing our posts. So this year, we right now have two state proclamations, Oregon and Colorado. We have a bunch in the wings waiting, so be on the lookout for those. Already awarded are all of those states there. And if you do not see your state, please email us. We would love to help you get your state proclaimed. This is a big part of our plan over the next few years to be able to check off every single state. And it's not as hard as you think. I've done one for my state. A lot of people on this call have done one, and we have volunteers to help you through that process.
Great. Amanda, I know this is a US based advocacy effort. Do you know of other international ones, or do you want to open it up to the group to see if there's other ways that folks have been able to share?
That's a good question for the group. I know that other countries have something similar, and we're more than happy to help collaborate and get some resources out to them too.
Thanks.
So if you missed it, we built a one-stop shop awareness toolkit. So as you are gearing up for next week, scan that QR code. You can open that folder. Inside there are some beautiful color pages for super sibs to send to school, for classrooms, a printable brochure that you can print out and send for to either take to your clinician's office or community center, swag, lots more. Go and check out that resource. That has been very popular. One big thing that I've been loving seeing is our All About Me pages. Many families have filled that out. That's also in there. It's an editable link where you can put your own warrior in there with their likes, talk about SCN2A, how it affects them. And I personally put that in my child's backpack on SCN2A Awareness Day, and the teacher sends it home in all of the kids' folders to go home with their parents. And on the bottom of his, it says, "Thanks for being my friend." So when other kids in the class talk about, you know, the little boy with the headphones that stims and flaps his hands, they can read about SCN2A and how it affects him. And then they can read a little bit more about what we do as a foundation and how it supports families like ours.
Brilliant.
And let's play this one.
Raising a child with complex medical needs changes everything. Your routines, your perspective, your heart. It can feel overwhelming at times, but what makes the difference is finding a community who truly understands. In that shared space, you discover you are not alone. There are families walking the same road, clinicians and researchers working tirelessly for answers, and advocates pushing for a better future. Together, they bring not just support, but hope. And hope is everything.
So before you jump back in, Melody, I want to thank everyone who is helping this campaign move forward. It's not just us, it's parents and grandparents and super sibs and clinicians with the right information. And thank you for all of your My Chart messages. I know that many of you have sent out that ICD-10 code to your providers, but it really is advocacy starting in your living room, and that's really where it starts. So thank you.
Amazing. Leah or anybody else, would you like to share anything before we move on to the next section?
I know personally what I'm going to be doing for SCN2A Awareness Day, and I'm sure all of you have something in mind. But I challenge you to be ready by the end of the call to share it. I'll share mine now. I am going to finally do the 6-month follow-up for the Dragonfly study because it is overdue, and it'll be my second one. So I think about it, and when we get to the end of the call, we should all share what we're planning on doing. Thanks for giving me that chance.
Sure. Thanks, Leah. Would anybody else like to jump in and say anything before we move on? We're going to hold it till the end. That's fine too. Okay, well, I did already a little bit of an introduction, but let me just share a little bit more. My name's Melody Kaiser. I live right in the Washington, D.C. area, which makes me perfectly situated to do all kinds of advocacy, external advocacy. I'm a mom to 2 children. I'm an empty nester. They're all grown up now. And I've got 2 crazy rescue dogs right now. I'm also a rare disease sister. Navy spouse. My background's in public health, health education, and bioethics, and I'm a board certified patient advocate. Um, I've also been a friend to the family's SCN2A Foundation for quite a while now, since 2022, I think is when I first met you. I wanted to share just a couple of pictures because this is advocacy in action as well, right? The one on the bottom is NIH Awareness Rare Disease Day, which is happening again this Friday, and I will be there with Jenny, and we're gonna have our table. And this one here was a CZI Rare as One network meeting. I go to lots of conferences, and everywhere I go, I make friends, I meet people, I share, I advocate. This one here was a NORD, National Organization for Rare Disorders, a NORD dinner. Rare advocates were invited, and I was lucky enough to be seated next to Jenny. And we were chatting SCN2A and other things at the table and stayed connected. And those connections from 2022 led to me being here now. And the connections that I make every day and at every conference and every LinkedIn and everything will bring back to your community to help as well. Speaking of LinkedIn, I just wanted to show you, it says I have 500 plus connections, but I actually pulled the numbers about 10 minutes before the call started. I have 1,657 connections on LinkedIn. And when Leah posts something, those people see it. So that's one of my easiest ways to advocate for you before even leaving my office or my desk. And I put my QR code right here, and you can see my name for LinkedIn. I would like that number to go up by the end of the call, please. I want to be connected to the folks on this call. I want you to see what I post. I want to see what you post, and I want to be able to share and advocate for you. And so rather than create slides for this presentation, what I actually did was show screenshots of our beautiful new website. We have an advocacy page that you can find on the About Us section. It's the first section on the top navigation bar. You can also scan this QR code, and it's beautiful and it's engaging and it's got incredible resources. And so I wanted to go through some of the advocacy activities that I'm doing in my new role, in collaboration with the other members of the team. Um, First and foremost, my job is to empower the SCN2A advocate. I collect the tools and the resources. Amanda, Leah, we all are bringing things, and we give it to you and help you share your voice. That's the most important part of our jobs. As I said here, we work closely with our partners to help empower our families to become strong advocates, whether it's sharing their story, raising awareness of SCN2A related disorders, or lobbying for change with legislators. We're here to encourage and support personal advocacy goals. So that's my great joy in life. Um, One of the areas that we talk about is legislative advocacy. So again, I'm right here in the DC area. I go down to Capitol Hill. I go to the rare disease forums. I go connect with, these are our partners from Every Life Foundation. They're hosting a large, humongous, I can't even remember how many attendees will be at Rare Disease Week on Capitol Hill, sponsored by Every Life. But Amanda's coming down for that. We're gonna chat. And actually, Amanda, can I toss this over to you for just a moment to share some of your activities that you're going to be doing next week on Capitol Hill?
Well, my schedule is very full. But a big part of my role next week is to meet with quite a few state representatives to talk about some bills that will be very helpful for our communities, for our rare disease communities.
Fantastic. And going back to the networking, that's 1,637. They're all going to be there, and I'm going to continue fostering those relationships. And every time I meet up with somebody, I'm hearing what they're doing, or I'm thinking about what we're doing, and I try to make those connections so that we can take full advantage of my network and everybody else's within in the network with what they have to offer and bring it back to your community. Some upcoming advocacy events next week is packed. So Monday is Rare Disease Day at the FDA. Tuesday is SCN2A Awareness Day and also Rare Disease Week on Capitol Hill. For Awareness Day, I have this fancy, I hope you can see it, my fancy new vest here that shows SCN2A Awareness Day, and you can get all of that on the website or go to a little shop at the bottom of the website, follow the little shopping cart. Again, the 26th through the 24th through the 26th is Rare Disease Week. Amanda and I will be at both of those. We also have Rare Disease Day at NIH, which was that picture I showed earlier. Jenny's coming down for that. And then the actual Rare Disease Day of Saturday. Rare Disease Day for all rare diseases is the last day of February. This year it's the 28th. On a leap year, it's the 29th, being the most rare day of the year. So stay tuned and check back on the website. If I have additional advocacy events, I'm always happy to share them. Other things that I share that you'll see in the newsletter or sometimes on social media, sometimes there's opportunities for individuals to advocate with their legislators to make change. So, for example, there's one right now to help support funding for medical nutrition and formulas. That's really important to this community. Sometimes it's getting genetic counselors to be considered Medicare or Medicaid providers and get reimbursement for that. So as I stay tuned and listen to all the different bills and proposals that are going forth for rare disease legislation, I share it with Amanda and Leah to pass off to the community and make sure that you have the opportunity to reach out directly with your story and let your lawmakers know why it's so important for these bills to go ahead and become law regulations. So other things that we offer, again, I'm a board certified patient advocate, and so I can assist either individually or collectively through a webinar. I can assist families help make informed decisions for either clinical care or research care. If you're struggling with something, if you have a problem and you don't know where to go, I can help find resources for you. So please feel free to schedule a meeting, or again, you can always reach out to Amanda and she can bring me in to speak at a caregiver event or anything that would be helpful. So. Regulatory advocacy. I think this is a big reason why I'm in this role. when I was talking to Leah, knowing that this community wanted to have a PFDD meeting with the FDA, and that's something that I had experience with. And again, I live locally to DC, and I get to attend many of the local events. And so that's one of the ways that we can really help with getting treatments FDA approved, which is not only important for them having safe and effective treatments, but that FDA approval also helps with reimbursement. And so, making sure that we're getting our voice in front of the FDA so that they understand the needs of the SEN2A community. Um, I pulled the slide from our last town hall meeting where I was announcing the PFDD meeting. You can see that the foundation, before I came, the foundation was already doing lots of FDA engagement. There was a patient listening session. Leah's attended something called the CPIM meeting. We often engage with FDA staff at conferences, whether we attend their sessions or we talk to them in the audience. I'm looking forward to seeing many of them at Rare Disease Week next week. I attend webinars and trainings. I'm going to their awareness day, their rare disease day on Monday. Follow them on social media and LinkedIn. So again, they follow me back. If I post something about SCN2A, my FDA colleagues are reading about it. If they post something of interest, I bring it back to the community. And so it's advocacy all the time. And speaking of the PFDD meeting, also known as an ELPFDD meeting, which means it's externally led, we're the hosts as opposed to the FDA being the host. Please save the date. It's Friday, October 23rd. It will be in the Washington, D.C. area and also online. So our international partners can join us online, and there'll be lots of opportunities. It's not just watching, there's interactive polls and opportunities to speak and share questions or share comments. So please either scan this QR code or you can go to the website and it's under events. Um, Other things, this is a big part. Oh, actually, I'm sorry, Amanda, it looked like you were unmuted there for a second. Did you want to share anything with that?
I was only going to say that for many of our families, that date sits beautifully around Warrior Challenge. And so our hope is families that are going to be coming to the ELPFDD meeting will stay for a Warrior Challenge type soiree or an event or something, TBD. But whoever's joining, we hope that you will do your Warrior Challenge with us.
I love that. I'm excited. And I can't even begin to tell you how meaningful it is to the FDA to meet families, but also on the reverse. As a patient advocate, I have witnessed families and communities being lifted by knowing that representatives of the FDA are attending their meeting both in person and virtually, and to know that their tiny little disorder is getting the big stage. Like for that one day, that one moment, everyone at the FDA who's engaged in patient advocacy and looking at the wanting to hear the patient voice, they're all there. You have their undivided attention. And then there's a long-term benefit as well, because there's a recording, and then we'll produce a report called the Voice of the Patient report that will influence FDA decisions about specific SCN2A treatments, but also treatments or products that might be used by the SCN2A community, such as medical devices or uh, testing even. So it's really important that the community comes together and has this moment. It's very, very powerful. So again, clinical advocacy. This is what I've been spending the very, very large majority of my time on in the last couple of weeks. As part of our strategic plan, which you can see on the website, the 2026 to 2029 strategic plan puts a big emphasis on making sure that clinicians and professionals are educated and are getting information from pre-diagnosis all the way through treatment. We're trying to catch pediatricians early on for early genetic testing. We're trying to catch neurologists as soon as they get those results to make sure that they're looking for the variants to make sure they're prescribing medications appropriately. We're trying to capture the whole clinical spectrum, school nurses, everybody that might be involved in care, and making sure that they have the resources that they need to provide competent and careful care to our families. Really excited about that. And a huge announcement, official as of maybe 3 days ago, we have received approval from the Minnesota Medical Association to be a partner. So as we create these continuing education materials for clinicians, they are certifying it and giving CME credit to our providers. That's not only helpful for them in terms of their career, but it makes it more likely that they'll take time out of their busy schedule to attend some of our meetings or attend our webinars or engage with our offerings online because they can justify the time because it's for their career development. So really excited about that. And then, of course, the ICD-10 code as well is part of clinical advocacy, and we appreciate all of you sharing. School and disability advocacy. Before I came to the foundation, that was a big part of my life. A special education representative, and as I told you, I've got two neurosparkly kids myself, and I've had more than my fair share of IEP and 504 meetings, and transitioned them to college, and had more than my fair share of those meetings as well. I've put together lots of resources, and there were already existing resources that Amanda and the team had put together. So we have those on our family advocacy resource page, which you can find under the caregiver, and you can also find the link on the advocacy page. I saw a hand just popped up. I can't see everybody, but is there somebody that would like to ask a question or speak?
Well, we have a
Somebody.
question in the chat, but I'm following up with it.
Okay, perfect. Sounds great. Thank you. Okay. And another huge part is research advocacy. So I didn't share this initially, but I joined the foundation as a TASCO member, a consultant with the TASCO team. And even when I transitioned off that team and came into this new role that was created, going from consultant to staff, I stayed on the TASCO calls so that I can be the liaison between our research teams and our scientists and our community, find out what they need, bring them the resources, and also just help to make sure, with the whole foundation goal of making sure that the SCN2A patient and family voice is present in all research. And so whether it's informing clinical trials or whether it's being co-authors on papers or funding the research that is important to the community or important to community drug development, we keep that advocacy role going. And then again, it all rolls back to making sure that FDA knows and legislators know and our clinicians know. It's all a giant circle of advocacy efforts.
Melody, can I interrupt just for a second?
Yes,
And go
please.
back to the clinical advocacy. Um,
Yes.
so I was thinking about that, and the foundation prioritizes this because we're still seeing patients not getting the proper treatment that they need. For instance, like a loss of function person maybe receiving sodium channel blocker medications. So this will help to educate the clinicians. Is there anything we can do as parents to get that out more? Like, would you recommend we stick it in our portal to our doctors, or like how should we advertise this more widely?
I love that. I love the portal because you know it's received as opposed to sending an email or dropping it off. But I also think it's a great idea to bring something with you to an appointment, whether you're wearing, awareness gear. That's always a great way. Put a t-shirt on your kid that has your information on it, to spark the conversation. Bringing flyers, we could create something that folks could download or we could mail to you. I love the portal idea. I love just the conversation. Maybe even when you've got your ICD-10 code card in your wallet, that QR code that's on that will bring them to all of these clinical resources. It's not just the ICD-10 card. So encourage them to take a picture right there while you're pulling out the card, and remind them that there are credits for them. There are CME credits that they can get. We are launching on Tuesday on SCN2A Awareness Day. We're launching a clinical learning portal that's going to have these videos and other creations. The team has been working so hard with these really fun artists to create an animated video. Even though it's geared towards professional adults, it's very engaging, and we're hoping that, it's basically SCN2A in 10 minutes. So we're hoping everybody can find 10 minutes. And if we keep it engaging and we put all the follow-up resources, we're hoping that that will get to the right providers. So we're encouraging people to share that as well. And that's something I'm going to share on LinkedIn because I don't want to just share it with my SCN2A clinicians. They already know. I want to share it with everybody. I wore this is my vest, but I also have my SCN2A jacket I wore my jacket to my daughter's pediatrician appointment a couple months ago, and the pediatrician was like, "What's that?" And I was like, "Let me tell you." And she knew just the tiniest bit about it. I think she had maybe one person that she saw in medical school, and she's offered to look at our video for, just for feedback. And I'm like, "Great, now I can offer you CME credit too. So thank you for your time, and here's how I get it out there." And so if I share it on LinkedIn, and you guys are now LinkedIn friends with me, and then you share it on LinkedIn, then everybody, it's getting to the right people. So that's how this works. It's grassroots, and it will take off. I'm really excited for that opportunity. So, um, did that, yeah. So research advocacy. Leah, I know you were going to share a little bit about some of the ways that the foundation either fund studies or create studies, including our natural history and registries and butterfly study. If you'd like to share a little bit more about that for research advocacy.
Sure. So, as we have gone along the last 13 or so years, the one thing that we hear all of the time from the industry groups, the pharmaceutical groups, biotech groups, is data. They need data in order to design their trials, in order to figure out, will this technique that they're working on work for certain things within SCN2A. So it's the single most important thing we can do is contribute our kids' story, our family's story through data. And over the years, we have created a few different places to do that. One was the CTRS, the Clinical Trial Readiness Study, which was published with at least five large publications now, I
Mhm.
believe,
Yes.
which has really helped to inform the field. And also, I think our number went from like 10 to 26 industry groups that were interested in SCN2A based on some of those publications. So it really makes a difference. And this is so important for you to do. So I personally participate in every opportunity that's out there. And I encourage you to as well.
Fantastic. Um, and I think one of the other ways that I use my network for research advocacy is I'm connected with so many different rare disease groups. To include, I'm also the advocacy co-chair for a group called the Global Leukodystrophy Initiative, where I work with 52 advocacy groups in the leukodystrophy space, which overlaps SCN2A just a little bit, in the sense that it's neurological, and it's often pediatric in first manifestation. And learning about these small rare disease groups, and knowing some that are just at the beginning of their journey, and some that have already crossed the finish line and have a gene therapy, and finding what their path was and what their roadblocks were, and how do we avoid their roadblocks? What can we do now to prevent the problems that they faced? That kind of networking and sharing within the rare disease space makes it really helpful to inform our research and our on our priorities. So I really value my network, as everybody knows, and my everybody in my network knows how much I value them. And I was saying to Amanda earlier, I'm like, we're going to the same conference, but I'm not sure if I'm going to step into any of the rooms because I have a feeling I'm going to be in the lobby the entire time talking to my network. And that's how we get stuff done. So, I shared some of the ways that I work for the foundation and how I'm helping to advocate externally. But again, going back to the beginning, the most important thing is to have the community involved, make a difference, donate, volunteer, raise awareness. Whatever you're doing to support advocacy is making such an enormous difference. And I'd like to open up the floor now to find out how do you spread awareness? What are you doing, and how can we support you?
I just added mine to the chat.
Yay. And I can't see the chat while I'm presenting, so maybe somebody could read them off to me or share. If anybody wants to
Sure.
come off mute and share, I'd love to open this to the floor and really find out how the community is getting involved. Leah, what'd you put in your chat?
I put a picture, but of Ben with his ICD-10 code with his neurologist.
Love that
I'm
picture.
not sure who's smiling bigger.
I went to an appointment when actually the first week that our ICD-10 code came out. And our neurologist couldn't believe well, he could believe because he knows how much work goes into getting that code for rare diseases like ours. And the smile on his face when he typed it in and then pulled it up beautifully on his screen. Um, it was a nice kind of Kodak moment.
Oh, that's beautiful, Amanda.
Did you get a picture?
I didn't, and I really should have.
You should stage it next time.
There you go. If I could actually follow up on Leah's picture, we took that picture and it's on our website now. But also, what's amazing about that relationship is, Leah has fostered not just a parent-child provider relationship, but also has fostered professional relationships with so many clinicians. And the clinician that's in that picture is also working with me on a project called Gene Reviews, where we are trying to get SCN2A related disorders in the website that is the go-to for genetic counselors and geneticists. They always go to Gene Reviews first, and we don't have one yet, but we will. Just like we didn't have an SCN2A related disorders Wikipedia page before, but we do now, and we're going to make it even better. So we're finding gaps and we're filling them, but Leah's and the whole team are pulling together this incredible network of clinicians who value the community enough to volunteer their time and to get to share their professional expertise, and it's really powerful. Who else? I want to hear what people are doing, especially for
Well,
Awareness Day.
hey everybody, I'm Jennifer Harvey. One of my favorite things to do is pass out our wristbands. I usually bring them to most doctor's appointments, and then recently to our pediatrician, I brought the SCN2A, but I kind of made a packet and brought a book and put Quinn's story with it. Um, and I love to email any doctor because our diagnosis came late. He wasn't until 15 and a half. So I've really target marketed any provider that has ever dealt with him. Any doctor, any neuro, any OT, PT, speech path, anyone, just to really spread awareness. And it sounds like there might be an opportunity to do a little target marketing with like the American Academy of Pediatrics or child, any neurologist to really spread the word.
Yes, that's amazing, Jennifer. I'm so grateful to hear that you're doing it individually and we're completely aligned. We have a humongous conference spreadsheet where we're sending teams all over the place, and one of them this year is targeted for American Academy of Pediatrics. We're also targeting the American Medical Geneticists Conference and other ones where we're catching people before they've come to SCN2A. We're encouraging them to do the testing and encouraging them to be thinking. And that's a big section of our video that we're releasing on Tuesday is talking about diagnostic red flags and when do you order genetic testing and when are you thinking about. And that's again going back to that network. There were 25 people involved in the creation of that video, and we could have had 100 more. Easily, but just for time constraints, we didn't. But there's so many people who are willing to volunteer their time and expertise because they believe in this community.
Yeah, I went so far when we first got our diagnosis to even write my OB because I felt like it
Amazing.
was so important because we knew when he was born that they were looking at something different, but they didn't know what they were looking at. So I think it's really important to get that awareness.
That's amazing. What a great idea. I wasn't even targeting the OBs, but I think that's a really great place to think to catch you. And they're the ones who have that relationship with you too. Your first 6-week visit or 2-week visit, depending on what how quickly they have you come back. That's with the provider that you know and trust, and you can confide in them to say, you feel like something's wrong and maybe you don't have a stronger relationship with your pediatrician, especially if it's your first child and or
I
maybe you
want,
think well.
I want, I want my children participate the study. Yeah, yeah.
I'm sorry, the sound cut off a
I
little bit. I
want
missed part of that.
my children participate the study. Uh, it's very important for me.
Thank you.
Eh, It's for I was a scientist.
Mhm.
I I like to contribute to a ciência. I love, I, I want to be more happy if my children with participate with this study.
Oh,
Será prazer. It's a pleasure for me. I want to be okay. I okay. Uh, I want to be. I have to know to Gabriel participate. Part. I want to be this participate with this. I'm sorry, I don't speak in English very well, but I don't. I understand very well.
you're
I
doing
don't
great.
speak it very much, but I understand very well.
We're happy you're here.
Thank you
We
so much for sharing. We really appreciate you.
You make a very good
So,
point too, that we should probably figure out how to do some better translation services for everybody on the call. Um, what is your first language?
my first language is Portuguese. My second language is English.
Okay,
My third language is French.
three
It's a
languages.
French.
Oh, I'm
I
always
We've
so
love
already proven
French.
on
impressed.
this call.
But I understand with I understand the the you're talking with you're talking everybody. E thanks, né? Thanks por me esclarecer, I don't know this, but esclaration with me for this, for this, for this pesquisa, né? For this research. I like,
You're a
yeah,
scientist, but are you also a parent of a child with SCN2A?
yeah.
Yes. Okay. Oh, we're so glad you're here. We do have a lot of resources on the website already translated to Portuguese, but you should probably check them for us and tell us how good they are.
Okay.
Love that. Anybody else want to share how you are getting involved, how you are advocating? Has anybody here been to see their state legislators or to see the
No,
federal in the
I'm
United States
trying
federal?
to contexto, né? Uh, contest. And I understand the contest. Yes, sim, vai. And sim, vai.
Fantastic.
Uh,
Leah, what's in the chat? I can't see it, but I bet I can see that there's 24 things that I haven't seen yet, so I'm sure
Oh,
it's
sure.
exciting.
A lot of it's me,
Oh,
Melody.
it's you.
Um, Adolfo is on, Cecilia's husband. They have a 1-year-old baby boy recently diagnosed, and they're just getting on board. And I know that because I saw when you were introduced to the group, because I commented that my father's name is Adolfo and my son's name is Adolfo.
yeah,
His middle name is Adolfo.
yeah,
It's nice to see you.
yeah.
Love it. Fantastic.
And then will any of us be at the disability policy seminar? Renee, where is that?
It's in DC on the week of, I just was looking at, we're sending a group from, I'm not going this time. I'm going to another one in Austin and March 23rd and 24th.
We should probably check with you
Let's
and show you our entire calendar for the year, and you tell us what we're missing because there's probably several that you can point us in the right direction. We're trying to hit up as many of these general disabilities and autism focused ones,
Hmm.
and not just epilepsy. As we were so epilepsy focused
Hmm.
before, but that our group is changing, obviously.
Disability policy seminar is kind of neat because it's each state sends their DD network, goes to disability policy and with self advocates. And I think we're sending probably 10 folks,
Mhm.
or a few from here at the USED, and then our DR folks from Disability Rights Arkansas and our Governor's Council. And each state does that, and they all attend at the same time. I was going to send them to you.
Yeah, please do. Thank you so much.
fantastic. Anybody else have something want to share? Jenny, what are you doing? I'm going to call on you since I've gone advocating with you. Jenny and I have
Yeah,
gone
yeah. Well,
with Alex.
my son Alex is 25 now, so I've done lots of different things for Awareness Day over the years, from, making special cookies and taking them to school and doctor's appointments, along with lots of information about SCN2A related disorders. And he's aged out now, so he's home a lot. Anyway, I'm going to take time that day to get on all of our medical portals, because we have many, and tell them about the ICD-10 code and that they need to be using it. Because honestly, the first appointment I went to after it came out, I completely forgot, and I feel terrible. So
Oh, good.
even though I have it on a keychain, I have it everywhere. But I think it'll make more of an impact if they see it in writing in the portal, because you're right, they actually do read those things. So that's one
Perfect.
thing I'm going to do that day.
And many
And as
families have been putting it through their My Chart, and their
Yeah,
doctors have been seeing it. So
yeah,
please, if you haven't done so already,
yeah.
definitely.
That's fantastic. And also, as you're sending messages to your My Chart or your portal or whatever, as of Tuesday, we're going to have the learning portal up as well. So if you take the opportunity on Tuesday to share with your doctors, make sure you have the ICD-10 code, but also let them know that they can get some CME credits and learn a
Yep,
little bit more. Fantastic.
absolutely.
And Jenny, I'm thinking about an advocacy opportunity that we had that didn't fit cleanly in this presentation, but Jenny and I went to Georgetown University and we brought Alex, or she brought Alex, and we got a chance to meet some graduate students who were now potentially going to either volunteer with us or work on projects, but if nothing else, they now know something about SCN2A.
That's right.
And
And
so
they're going to
they
go out
maybe
in the world and know in their worlds
yeah.
and know what it is. Yeah,
Exactly. That's a big part. I think actually maybe I should have added an extra slide about our student opportunities. We frequently have student interns or work with academic partners to help train the next generation of rare disease advocates or genetic counselors or bioinformatics students. And they whatever we share with them, they take with them to their next network.
Are y'all working with any of the state's LEND projects?
What is that one?
It's LEND, it's Leadership Education and Neurodevelopmental Disabilities, and
No.
each state has one. And it's a pre-service program for professionals. There's usually, developmental peds. We have genetic counselors, speech paths, OTs, PTs, the whole gamut. And it's a paid internship that folks can become a part of as they're finishing their postdoctorate or postgraduate programs. And we go and train. They spend days with Carson here in Arkansas. Um, and so that may be a piece to figure your way into.
Renee, that's so helpful. Thank you. If you possibly be able to share something either in the chat or maybe you could
Oh yeah.
email me or Leah, I would love to learn more about that. We're starting to compile a list of all the places we're going to connect with.
Yeah.
One of them, for example, is something called Project Echo that I was part of yesterday, and we're going to be submitting SCN2A cases, and that's a project where they're bringing primary care providers and rural
Mhm.
providers, folks who don't have access to the deep specialty centers, and they bring them together. And so that's another avenue that we're hoping to advocate with.
We're an Echo site.
You're an Echo site. Oh, amazing. Oh, we definitely have to talk, Renee. I would love to connect with you. Oh,
And so yeah, so there's several different universities around the country. So UPenn, we work with them a lot. Work with a lot with Oklahoma and Texas, Mississippi. Lind is we are under our Lind project still, and so I'll send you some stuff.
thank you. See, look, I've networked.
Yes.
And speaking of networking, has anybody followed me on LinkedIn yet? I hope my numbers are higher by the end of this call. And Amanda too, and all of us, our whole team.
Elliot wants you to know that he's going to talk to it. There's a few Lend Fellows at UPenn, so he's going to ask about how to get involved there too. Elliot is on the call. He is actually, Melody, you should introduce Elliot.
Yes, Elliot, and actually, are you comfortable coming off mute and saying a quick hello? We've been working with Elliot from UPenn Genetic Counseling. He's our spring intern.
Yeah, hi. I'm from UPenn. I'm a genetic counseling student, and I'm working on some projects, including the Wikipedia page and the gene reviews. But there are some, I think, two Lend Fellows in the second year class of my program, and then as we move up, we have the option to become Lend Fellows. So I can ask, what's that all about and how to get involved.
Amazing. Thank you, Elliot.
Carson's sister was a Lind Fellow.
Very cool. It sounds like a great program. So glad to hear about that. And as Elliot mentioned, he's helping with the Wikipedia page. That's another way that we're trying to spread awareness because the very large majority of people now are in some way influenced by AI and ChatGPT and everything. And Wikipedia turns out to be quite the source for AI to gather information. And so we're working really hard to go through not only to correct old pages or update old pages, but also to create pages that didn't exist and to make sure that SCN2A is listed in pages that are related. So for example, if we go to an autism page, we want to make sure on the genetic section that it lists SCN2A as a genetic cause of autism. And so that might just be one quick little edit. But then huge pages, we created an SCN2A related disorder page that did not exist. There was only a SCN2A gene page with a little tiny comment about how it might impact individuals. And we said there needs to be more. And so Elliot and I don't know if Liz is on the call today. We have a genetic counselor volunteer who just recently joined the foundation, and we're working really hard to get that page updated. And the timing of it is so that we can nominate it for the Did You Know page. There's a Did You Know or I can't remember exactly what it's called, but you can nominate your page after it's a brand new page or recently updated. You can nominate it and it goes on the front page of Wikipedia. So people who are just scrolling Wikipedia will see, hey, did you know that the leading monogenic cause of autism is SCN2A? And they're like, what's SCN2A? Click. And now we've advocated. So just trying to spread awareness. So thank you, Elliot, for all your hard work on this. We're going to get that updated this weekend and nominate it and hope that it can roll out next week.
Melody, would you put up that toolkit slide,
Yes.
please?
Yeah. I'm sorry to make people dizzy as I scroll backwards.
For anyone who wants that QR code for the toolkit.
Oh my goodness, I went right past it. Where is it?
Not that one.
Where'd it go?
Right there. Oh, back.
There it is.
There it is.
There it is. Okay. Sorry. It was covered by my the part of the screen that had all your pictures and faces on it. I didn't miss that.
So this is a QR. There was a question in the chat. This QR code will lead you to this toolkit, and in Explore and Share, there are some folders in there with our logos for you to be able to use.
Fantastic. If anybody has any trouble accessing it, I know while I was sitting here on the call, I tried to scan it and it wanted me to log in and pick which Google account I had. And so if there's any obstacles, let us know and we can get it to you a different way. Potentially also, if it's not already on the website, Amanda, we can absolutely add it. Fantastic. Well, I know we're pretty close to time. Is there anybody else who'd like to share or anybody who has questions if it's your first SCN2A Awareness Day? I've seen some comments on Facebook. Maybe we could share some great ideas that folks have shared on Facebook. there anything that stood out? Oh yay, I have a new follower. Thank you, Cecilia. I appreciate you.
I think that was Adolfo.
Oh,
I think yeah, you didn't see that one. Adolfo is using
You said yes.
Cecilia's.
oh, sorry.
Yeah.
Okay. Well, thank you, whoever followed me. I appreciate you, and I hope that yay. I hope that others will as well, so that I can share information and you can share with me, and I can make sure that it gets to the right people. Because playing Cupid is my favorite thing, so I love connecting people and resources.
Thanks everyone for joining us today as we gear up for SCN2A Awareness Day next week. And as Melody just said, we're here for anything that you need. Reach out for any resources or questions.
Awesome. Thank you guys.
Thanks, everyone.
Thanks, everybody.
Have a nice weekend.
And have a great Awareness Week.
Yes. Post lots of pictures.